Urban health and health equity pathway is designed for residents who want to take a deep dive into issues related to health disparities and health inequities that face the many populations that we serve here at Boston Medical Center and in the greater Boston area. So in this pathway, you get pretty significant training around things like social and structural determinants of health, and you get training around many of the clinical issues that affect historically marginalized populations in our area. There's several major components of the pathway, including clinical training in things like immigrant and refugee health, addiction medicine, hepatitis C, neighborhood medicine, depending on your interests. We have a week together as a shared elective every academic year where we can go explore the city together and learn a bit more of the story of our own community here in Boston. And residents participate in a mentored scholarly project sometime during their training, which could be research, it could be developing curricula, it could be working on advocacy.
I chose to apply to the urban health pathway because I really wanted to learn more about how social and structural determinants of health impact the patients that I serve. I wanted to be able to get more tools to learn how to be a better advocate for my patients, and I intend on practicing at an urban, probably academic safety net hospital, so I figured these tools that I'm going to get would just serve me really, really well in my future career. During our last Urban Pathway Week, we got to visit the Massachusetts State House and meet with Representative John Santiago, who is one of our state reps and a graduate of the Emergency Medicine Residency Program here at Boston Medical Center. He is a wonderful advocate for the patients that we serve and is working very fiercely and devotedly on outcomes related to substance use, trying to get more reliable housing for the patients that we serve. We got to take a tour, talk to him, but that was a really wonderful and unique experience, and I got to see firsthand how you can be an advocate for the patients that you serve, really at the kind of highest level. And that was a really wonderful, unique experience that will, I'm sure, stick with me for the rest of my life, and I don't think that you probably get at a lot of other places, and I don't think I'll probably get again.
I feel very lucky to lead the pathway because I get to continue to participate in this education every year, and I know that I learn every single year more about my own city, where my patients live, and how I and we can do a better job taking care of them.